Okay, so we're actually going to start with a poll that would actually ask some questions about HIV self-testing and what may be some of your concerns or thoughts that you may have in your head about HIV self-testing, even before we begin to have this particular conversation. So I think Camille is going to share the poll so that you can actually respond. And if you can actually respond to the questions, then we would be able to see what the thoughts are of persons who are actually participating. Okay, so we're starting to get in responses. Thank you. So a number of people think it will impact positively by facilitating individuals who may not want to access HIV testing within the health services. Some people are concerned about loss of data by the Ministry of Health. And I think one person talks about concerns about violence and possibly the issue of may impact negatively due to poor tests or performance of the tests by the persons using them. So we have a span of responses, but I think the majority of persons think it will impact positively with some concern about data and test performance, and some about violence as well. So thank you. Thanks, Camille. So we'll move to the meat of the matter now. Okay, so we'll stop sharing the results, I think, and move on to the slides now. Camille, I don't know if you can move the slides from your end because they've stopped moving again here.
Okay, let me try.
If you're not getting through, I may have to just reload again, stop sharing and then share again.
Yeah, you might have to do that.
Okay. So what is HIV self-testing? And many of you may be aware already, but we just, for those who may not know or those who may need some clarification, HIV self-testing is a process in which a person collects his or her own specimen, whether it is oral fluid or blood, and performs a test and interprets the results. And they can do this in private. They can do it with someone who they trust. It can be done with a healthcare worker whom you trust or with a partner. So there are many ways in which you can do it. But the point about it is that it is actually being done by the individual themselves. And the World Health Organization has actually pre-qualified some HIV self-tests. There are only 4 self-tests on the market that are WHO pre-qualified, meaning that WHO has done the testing on these kits and has verified performance levels within environments where the WHO has done the testing. So the blood kits that are actually pre-qualified by WHO are the SureCheck kit, the Mylan, and the INSTI. And then there's only one saliva test, the OraQuick test, that has actually been pre-qualified by WHO. So who and how can HIV self-testing assist in our work within the region and for the populations within the region. The WHO HIV self-testing can assist many different populations within the region. The general population, of course, for those persons who may want to test, and in fact, it's anybody who wants to test but may not want to go directly into a health institution. Whether we, and these populations listed here are really from the WHO self-testing guidelines that came out in December 2016. General populations, pregnant and postpartum women, couples and partners, adolescents who may want to test, young people, key populations, of course, and any vulnerable populations who may actually need and want to do HIV self-testing. We know how can it assist. We know that HIV self-testing, or not HIV testing in general, actually, and I mean, COVID-19 has raised testing into, the eyes of the world, but I think those of us who are working in or have been involved with HIV programs or involved with HIV personally know that testing is the cornerstone of the prevention services. The COVID-19 pandemic has unfortunately interrupted HIV testing services because of lockdowns. Persons may not have access. Persons may be economically challenged as a result of these lockdowns and not be able to come out and access testing. Many different things. Sometimes, in some cases, the testing sites have been reallocated for other things given the COVID pandemic. So it has interrupted HIV testing in some cases. And we do need innovative strategies such as HIV self-testing to expand access to testing as a result. So in a sense, the COVID-19 pandemic has driven us to think more about where and how can HIV testing be incorporated into what is our HIV testing strategy within the Caribbean region. And when we look at who can this benefit, this data, this infogram was just recently put out by PANCAP, looking at HIV in the Caribbean at a glance, the 2019 data. And it showed that when we look at the KP, well, in fact, at the general population in terms of the cascade, we see that 77% is estimated in the Caribbean, where we want to reach 90, that 77% of the people living with HIV know their status. So we're actually starting already with a significant deficit in terms of people who know they are infected. And then with respect to those who are on treatment, 81% of those, and then of those 80% who are on antiretroviral therapy and are virally suppressed. So, and it's estimated that there are 330,000 people living with HIV in the region. So if we are falling short of that first 90 by 13%, then that's really a significant amount. And therefore, we really need to address how do we close that gap. So the WHO HIV self-testing guidelines in 2016 actually came out with what were new recommendations at the time, and I left that on the slide because it was new at that time, that HIV self-testing should be offered as an additional approach to HIV testing services. And this was actually because it was recommended, but we have not actually implemented within the Caribbean. For us, it's actually really a new recommendation that we're looking at within the Caribbean and how this can be implemented. And the discussions are underway with PANCAP, with PAHO, with ourselves in terms of looking at, and with CVC in terms of looking at how HIV self-testing can be rolled out within the Caribbean. So the WHO HIV self-testing strategy is very important to understand where HIV self-testing fits in the scheme of things. When an individual would perform an HIV self-test, they will test either a positive result or a negative result. They'll get a reactive or a negative result. If they have a reactive result, then it is very important that they actually get linked into HIV testing for the purpose of ensuring that they actually are positive. These tests are calibrated and these tests are made so that they would actually tend to err on the side of giving you reactives in persons who may or may not be positive. And therefore, it's really important to make sure that the test that comes up reactive in the hands of someone doing a self-test is a real positive. And that is a very, very important thing that anyone who's using a self-test must understand. Likewise, if you get a negative, there may be need for retesting depending on whether the person feels that they have had a recent exposure or they have risk factors. And of course, the linkage to prevention services is really important. Any person who is actually uncertain about their HIV self-test results should be, of course, accessing facility-based or community-based HIV testing. So the need for ensuring that people understand where self-testing fits is a really important key in terms of our trying to decide where and how do we fit HIV self-testing into our regional landscape. Self-testing is definitely not recommended for persons who are taking antiretroviral results, as that can cause a false non-reactive result. But in fact, we really need to understand self-testing, and that is why it's really important for us to understand, for example, the whole idea of a window period. Persons who may take an HIV self-test may do that because they've had a recent exposure and they want to know, how I was exposed, am I HIV positive? We all need to remember the lesson about window period. We talk about it all the time. It's really a period of time, and you see this, it runs into weeks. This illustration actually shows us that for 3 weeks after infection, it's only at that point that HIV antibodies start to rise. And even if they're rising at that time, it does not mean that they would be sufficient for the test to pick it up. A test can only pick up when you reach a certain threshold. There are other tests that can be used earlier, things that would measure DNA, things that would measure the antigen. But when we're talking about a self-test, the self-test actually measures antibodies, which is the test, the same as a rapid test that you would go for in a community-based testing site or a health service testing site, measuring antibodies. And when you're measuring antibodies, there is a significant window period that you have to take into account before you can even expect the test to be reliable. So the objectives of the WHO HIV self-testing guidelines that were developed in 2016 were to support the implementation and scale up of self-testing and assisted HIV partner notification, and to provide guidance on how it could assist in and how it could be integrated into services. It was really, the guidelines are intended to support the introduction of HIV self-testing as a formal intervention in countries using WHO quality assured products and quality assured products that are approved by local and international bodies. So even though you may have WHO pre-qualified tests, it is important that you have local and international bodies approvals for these tests to be used in country. And of course, it is really intended, the guidelines were intended to actually position HIV self-testing and assisted partner notification to contribute to those achievement of those 90-90-90 targets and the 2030 targets, which are even higher at 95-95-95. So this was the idea behind HIV self-testing. And so one of the things that we are looking at within the region is to look at the use of these HIV self-tests in reaching people who may actually be undiagnosed with HIV. And we are looking in the region at using the oral test that I mentioned earlier, the oral quick test, which actually does not require you to take a blood sample, but it actually uses saliva where you're actually checking for antibodies. And so it really allows those persons who actually want to test themselves and to test in privacy to do so. You have two different kinds of HIV self-testing. It's important to think about how we actually will utilize self-testing. You can actually have directly assisted HIV self-testing, and as we're introducing, this is the way that we're thinking in terms of introducing the HIV self-testing, that a trained peer, so somebody who is in one of the organizations, CSO organizations that supports key populations, someone who is a trained healthcare worker, would provide a brief demonstration on how to use the test and how to interpret the results. And of course, provide either face-to-face or some kind of online instruction while persons are using the kit. And the instructions would actually be included with the kit to provide whether it is just written pictorial kinds of representations or video type and so on. And we're looking at a mix of those kinds of supporting materials. Unassisted HIV self-testing is where the instructions are included in the kit and people just take it home and they do it on their own. And that may take place at a later stage, but we're really looking at the peer-assisted to begin the process. So when we talk about HIV self-testing, you can think about HIV self-testing in the context of how do we actually, deliver HIV self-testing. And there are many different ways it's being done internationally. This is at WHO, and I'm sharing with you some WHO slides at this point, as you would have noticed. WHO actually has looked at community-based models, partner-delivered models, facility-based models, which is the sort of peer-assisted and healthcare worker-assisted model. Then you have pharmacies that can actually sell HIV self-test kits, and we know that happens in the region and even outside of the region, where people can actually order and have their own self-test kits delivered to them from outside of the region. You have workplace programs where people may be given HIV self-test kits, and it could be integrated into STI treatment, reproductive health services, and so on. And then you have those that are more sort of internet-based, supporting pre-exposure prophylaxis type programs. So these are the ways in which HIV self-testing can be delivered. And of course, you have things like vending machines when it becomes that well-known and so on, where you actually can integrate into the system. As we start, as I said before, we are looking at starting slowly and not trying to do everything at once. Just some data to share with you, the WHO data that has actually indicated how self-testing has helped. In across studies in Africa and in America, Asia, Europe, where they've actually been using HIV self-testing, they found that HIV self-testing can identify 2 times as many HIV infections as standard HIV testing services. So this actually is a major step in terms of being able to scale up HIV testing, and that actually is a really important factor. And looking at the positivity rates that, in terms of the positives that are picked up through this use of HIV self-testing, it ranged from 3 to 14% among the general population in sub-Saharan Africa, and between 1 and 30% among key populations in Africa, America, Asia, and Europe. So it actually really allowed the identification of persons who are infected and who may very well be persons who do not know that they are infected and who need to be engaged in coming into the care for HIV before they actually progress to further circumstances. In terms of linkage to care, we actually have a slide here that shows how linkage to care has actually been achieved, because this is one of the issues that I think was identified early on when you took the poll question. The whole issue of, okay, when people actually get a reactive result, are they going to come into care? And they actually have data that shows that you really have very high percentages of persons who actually, in the general population, somewhere between 50 and 56%, and 20 to 100% among KPs that actually enter care, who actually enter care, get their result confirmed, because before anything happens with HIV self-testing, remember, if you have a screen positive, it is simply a reactive result, and you have to have confirmation using the national algorithm before you can actually say that this person is truly HIV positive. So those persons who may have a reactive screen, it's really important for them to go into the health services and be properly tested, adequately tested, and then taken into care and treatment as necessary. The other issue that I think people were concerned about, there was some concern about violence. And in fact, this again, all this data is coming from WHO, and they actually showed that there was no identifiably increased risk of social harm and adverse events. And they have actually been monitoring this for quite some time with respect to those countries that have actually, and in fact, countries that actually implement self-testing. Part of the implementation is actually to look at the post surveillance so that you can actually see what happens. Is there any violence, partners, forcing others to be tested and so on. So these are reports from studies. They did not suggest any increased risk of harm. In Malawi, they actually had 2 years of implementing HIV self-tests, no suicides, no self-harm, no cases of partner violence. Reports of coercion were identified were mostly among men, who also reported that they would recommend HIV self-testing. So there may be some coercion. All these things actually are things that would have to be tracked to make sure that they're not actually becoming an issue within the populations that are served. In Kenya, they did note on this slide that you can see that 4 cases of partner violence were identified, but it was unclear whether they were due to HIV self-testing. So the principles that HIV self-testing must uphold are that they must adhere to the World Health Organization 5 C's of HIV testing services. That is consent, confidentiality, counseling, correct test results, and connection to the health services as required. So they must also address country social and legal barriers to access and uptake the HIV testing services. And that's one of the reasons why you would see that we're actually looking at, in the introduction, how are ministries of health going to be engaged? How are we going to ensure that HIV self-testing becomes an accepted part of the policy framework for HIV testing in these countries? And how do we support people in testing so that they can actually get the counseling, the information that they need, that they get correct test results, that they understand what the test means, and that they actually are connected to the health service if necessary. This is just a slide I put to share with you some consultations that we did on HIV self-testing in Trinidad and Tobago under the USAID Linkages Project 2018 and 19. We interviewed, I think, I can't remember exact number of persons, but somewhere around 80 to 100 persons were interviewed. And they thought that self-testing is feasible and useful. It actually does address some of the confidentiality, stigma, and discrimination concerns that people may have in going into testing sites where KPs, for example, may feel that they are targeted with discriminatory behavior. Some Ministry of Health and CSO sites are considered KP friendly, while some KPs feel discriminated against at other sites. They did not actually, interestingly enough, express major concerns about persons being forced to test or violence related to testing. But here were the concerns that they raised: the potential loss of data for the Ministry of Health when persons conduct self-testing. The testing for HIV using only an HIV self-test could actually result in lost opportunities, which is interesting. Lost opportunities for STI testing. Some KPs regularly monitor their sexually transmitted infections by getting tested. And so An HIV self-test will only give you HIV, but it won't give you the rest. So people would still have to access the rest elsewhere. They also felt that self-testing really needed to be supported by widespread campaign for education, because it is really critically important that you do not lose the opportunity for sexual and reproductive health education that comes along with, for example, somebody going into an HIV rapid test site and being engaged by a counselor. Of course, the importance, and this was a really critical thing, the understanding the implications of the results and access to follow-up to self-testing, including the need for persons to understand the window period that exists, and therefore how the test fits in the scheme of things. And you know, we talk about this because this is an aspect that people who are not involved in lab testing every day and so on may not necessarily think about, and that's why it has to be highlighted again and again, that you have to use the test in the time frame when the test would be likely to be positive. And the KPs also expressed concern about sharing HIV positive status with their partner. When we talked about assisted partner notification, there were still concerns at this point in time within the time that HIV has been around, that persons are still concerned about sharing their positive status. So this was just data, as I said, from Trinidad and Tobago. What are we looking at doing now? When I was asked by CVC to do this webinar, I think we had not actually had any response yet from Global Fund and so on, but we were looking at, okay, so HIV self-testing implementation really requires a number of steps to take place. We need to select WHO pre-qualified tests, HIV self-tests. So that list 4 tests that I gave you. And because we know that people in the Caribbean are not very excited about needles and sticks and needle sticks and having their thumbs or their fingers pricked, we actually are looking at the use of the saliva test, which has performed well in other environments. I haven't put up the data on sensitivity and specificity of the test, because I think, you know, that's really part of what we would look at as we look at the introduction of these tests. We would need to look at submission of a protocol for national ethical approval. The Ministry of Health has to approve, because we are introducing a new methodology into the countries. We would need to consult with country teams to select organizations where, in fact, we would try to manage and distribute these tests, and to triage, that is, do the partner assist, the worker assisted or the assisted self-testing, as I mentioned earlier, because we want to start with that assisted testing. The reason for that is that in the first phase, what we would really need to do is to verify, is the test working well, and how is it working in the hands of the persons who are using it, and how acceptable is it to the persons who will be using it. So that's part of this study that would have to be done in the introductory phase to see how well is the test working compared to the tests that we have now. We all have national algorithms that we're using for HIV testing. So we need to see how is this test performing against that. We would not want to put in place a test that is not giving good results in the hands of the persons who are using it. That's not to say that it's not a good test. Sometimes it's just that the tests maybe have instructions that may be challenging to follow, or people may have some difficulties with actual performance of the test, and therefore we need to make sure that that is actually working well. We also have to look at how acceptable is the test to the persons who would actually be using it, and therefore we would work with KP organizations and the Planned Parenthood partners within the region to ensure that there are organizations that are identified, persons that are identified. We would have to develop appropriate support materials, communication materials, data collection and monitoring tools. which includes the feedback on how is the test actually working. But beyond that, there are also monitoring tools that would be put in place beyond the initial phase. I put this slide really to share with you a communication, one of the communication tools that was developed in Trinidad under the Linkages project. I believe a similar tool was developed in Jamaica, where in fact this is called D-Link PT, and it's really a platform where persons could actually, and this was because Linkages had set up a network of peer educators who were actually supporting persons to get HIV testing, to access sexual and reproductive health services, to get HIV, STI treatment as the case might be, and even things like substance abuse treatment, legal advice, and support for gender-based violence. So this was a very comprehensive platform that was developed. It's an app actually that you can use on your phone, but it can connect you with persons who can actually support, whether it's just simply doing the HIV self-test, or if it is to get into testing, get into counseling, get into further testing if necessary, and so on. So this is just an example. We're looking at it as one of the examples of apps that can be perhaps adapted for use to support not just HIV self-testing, but to support the kinds of sexual and reproductive health support that people need. And so this is an important, just an important flag, and it was actually developed, as I said, by the Linkages project under the USAID FHI 360, which ended in Trinidad in 2019. As we look further at implementation, next we of course would need to train the testers and counselors for triage, and I mentioned triage before as the assisted HIV self-testing, so that there would actually be persons who can assist others, the persons who want to use the test in the field. We would have to conduct the pilot, collect data, verify the test performance, collect the data on acceptability among the clientele, and provide the communication materials to support and encourage HIV self-testing. So this would be part of what would be done and within the pilot. And of course, having analyzed the data and produced a report, one of the critical things is going to be developing a regional policy framework and an SOP for HIV self-testing as part of the national HIV testing policy. If we want to have this accepted as a way of encouraging people to do testing, then we need to make sure it's integrated into the national HIV testing policies. And that's one of the reasons for doing the verification, the acceptability study, and so on, to ensure that the data is there to show that it works well, it's acceptable to those who use it, and that the feedback into the system is actually going to take place. And then as you look at scaling up, there are, as I mentioned earlier, monitoring and surveillance tools that would actually would be in place to ensure that there's feedback into the system about whether people are coming into the system, if they get a reactive, whether people are experiencing any coercion or violence as a result of using these tests, so that there can be interventions and there can be things done to resolve these issues if they do arise. So it's really important that data collection continues well beyond the pilot, because the pilot is really to establish those things and then to continue them beyond that. So the current situation is that funding has been approved for the pilot, and actually both the PANCAP and OECS Global Fund grants, because of COVID-19, were actually facilitated in putting in requests to the Global Fund for a response mechanism to COVID-19. And as part of that, as I mentioned at the start of my presentation, the use and introduction of HIV self-testing was incorporated as a major element of those project submissions, which have since been approved by the Global Fund, and therefore the implementation should soon start. The verification and the feasibility for HIV self-testing is incorporated into the approved funding, and therefore it should begin within a very short period of time. So a draft protocol, we've already developed a draft protocol and it's being finalized, and then would have to be submitted to countries and discussed with countries. Of course, nothing can go ahead without country approval, and the ministries of health would have to do that. And of course, the training material, we've begun to look at what would have to be done with respect to training and to support the introduction of these self-tests. And I mentioned to you the kinds of training that would have to be done. And the plans for communication materials in terms of, looking at who might be able to assist us with communication surrounding HIV self-testing. So we're in the process of just initiating the going forward with HIV self-testing, but I think one of the most important things is to begin the conversation regionally, which this actually does. This begins one of the conversations that will have to take place about HIV self-testing to get from people what their thoughts are, what their interests are, what their concerns might be, so that going forward, we can address those things. So I think moving forward, HIV self-testing can provide direct access for individuals and their partners to HIV testing. The pilot in terms of verification to ensure that the selected tests work well when used by the individuals and to determine acceptability among them is something that we are already planning for. HIV self-testing can support meeting regional and international targets for identifying and providing care to HIV-infected persons, so that being able to identify those persons who may not at this point in time know that they may be HIV infected. As you saw from the data that I presented from some of the WHO data, it shows that in fact they already had a major increase in persons, identification of persons who were infected using HIV self-testing. And of course, it must be facilitated by national HIV testing policies, because HIV testing policies really need to be adjusted to include the fact that HIV self-testing would be one of the modalities that would be recognized within country as a first step in screening persons, and then that they would then enter into the more formal process of being tested, and also from there, once they are tested positive, into care and treatment. So HIV self-testing has a lot of potential. I think many of the persons who answered the poll initially answered in that regard. So we have two more poll questions before I begin to take your questions. And the first one is, would you want to participate in an HIV self-testing pilot? Just to know how people feel about it. Okay, so we have 11 persons, 12, 13, 14, 15 is going up. Okay, so we have 89% of persons, 90% saying they would want to participate. I think 60% of people have voted so far. So it looks like quite a number of people would be interested in participating in an HIV self-testing pilot. And this may be persons who may want to function in the role of triage to assist others, or they may want themselves to try the HIV self-test. But this is very good. So it means that we actually do have quite a number of people who are very interested in being involved in HIV self-testing pilot. And if we look at the next question, I'm not sure if I control this or you control this, Camille. There's another question, right? Thank you. Another question, what action is needed to make HIV self-testing successful in our countries? And just to get from people what you think are some of the really critical things that need to be done within our countries to ensure that HIV self-testing would be successful. Communication and education materials to support by trained persons, whether it's virtually or face-to-face, guidance and support for persons who get a reactive self-test, verification and determination of acceptability of the selected test, the national testing policy that includes HIV self-testing, the marketing of HIV self-testing, or maybe you think nothing needs to be done. So seeing the responses are coming in. So I think communication and education materials, very important, clearly coming up very important. The policy also seems to be getting some traction in terms of the national HIV testing policy. Okay, so we actually have, I think, 66% of people have voted. I guess we're going to wait if there are any more. I think most people seem to have, those who are going to vote seem to have voted. So the communication and education materials, clearly very important. Guidance and support for persons who receive a reactive test, the national policy, and the support by trained persons. All of those seem to have been areas that people feel are significant. And the marketing, slightly less so. But I think the policy and communication materials seem to be the areas that have the most support. So thank you very much for participating in the poll. And sure if you've actually seen how the results are. Okay, so here we go. Now I am open for your questions. So these slides have stuck again. But in any case, that was the end of the slides. I was just going to thank you. And we can take questions now.
Thank you so much, Valerie, for such a detailed and informative presentation. Remember, in terms of questions, if you want to voice a question vocally, you can use the raise hand feature and we will acknowledge you and unmute your mic. But let us first take a question from the chat box, Valerie. The question is, are the blood-based self-test kits more accurate in terms of higher specificity and sensitivity than the saliva-based kits?
No, they're not actually. The kits, all the kits that are, and we have to talk about it in the context of the WHO pre-qualified kits. WHO actually uses a cutoff in terms of sensitivity and specificity for kits that are pre-qualified. And actually the OraQuick perform very well within the WHO assessments. It is a test that we would want to verify. I know that verification of the performance of the test didn't seem to gain a lot of traction with persons who responded to the poll, but it is important for us to make sure within our region that people use them well. But no, there's actually no major difference in terms of accuracy and sensitivity and specificity between the blood-based and saliva test. I think.
Okay, the other question from the chat box is, are there any information on how the self-test kits are disposed after testing?
Yeah, so this is something actually that is generally is provided within the kits, but I think it's going to have to be something that is highlighted as part of the information that is provided to persons in terms of disposal and so on, so that people would actually dispose of these things as they should be. It's really not, it's not, and in fact, because we're actually looking at the saliva test, it actually is going to be a test that can be disposed of without a lot of difficulty, but we really want to make sure that people know how to dispose of them and that they don't leave them lying around and that kind of thing. So that will have to be part of what is in the communication package that would accompany, you know, the test kits.
Okay, let's head over to the Q&A section. Another question, are the self-test kits packaged for individual use, meaning can someone purchase a single kit that includes the test instructions, lancet, and alcohol swabs?
Yes, no, usually if these are marketed now, the idea behind the introduction is not to have them in pharmacies and everywhere, but in fact, it would be single-use kits that would actually be provided to people so that they could actually use the kit themselves and get their own result. So yes, they are packaged in that way. It's not packaged, self-test kits are not packaged in the same way as the kits that are used in, you know, a lab or in a testing site where you'd have, you know, large numbers all together. They are packaged for individual use.
Okay, the other question, what is the unit cost of an HIV self-test kit and who is asked to cover that cost?
Oh, okay. So I don't have information right now on the cost of the kit and what the kit would actually cost if it were to go on the market, on the general market, because that actually hasn't been looked at in our region at this point in time. There are self-test kits that are being marketed. I would have to check my data in terms of how much those kits are actually being marketed for. But we did get a pricing in terms of the test kits. I would have to check that though in terms of, because we were looking at a number of test kits that were being purchased, but I think they ran to somewhere around, and that's in our region. Outside of the region, the costs may be quite different. And that's also part of what needs to be worked out. The WHO, because it's a pre-qualified WHO test, PAHO does have a system for purchasing these through the PAHO Strategic Fund and so on. But if it's actually brought into the region, as we know, by a supplier who is actually marketing it, then the price is going to be very different. It may be several times the cost. So where you're talking about a $1.50 or $2 test, then it could be a $10 test, depending on what your source is and how it's actually brought into the region. So all of that has to be looked at in terms of, you know, as countries, if countries are actually going to authorize and recognize the use of HIV self-tests, then the source of the self-tests, which self-tests and how they would actually be marketed. So if it's being marketed in the private sector, then it's going to have a very different price to, you know, those that may be accessed through an NGO, a CSO, or, you know, a health facility.
Okay, thank you for that response. Another question, Caribbean practitioners are concerned about the reaction of someone testing positive at home. What are the experiences in other places? How have persons responded to a positive test result on HIV self-testing? That's the first part of the question. And the other part, how many are coming into testing for confirmation? And in the absence of pre and post test counseling, how is this addressed?
Okay, so in fact, that is actually one of the reasons why in the introduction of these, remember I showed you all the different ways in which these test kits can actually be provided through pharmacies, through vending machines even, and also through facility-based. And as we're introducing and looking at the introduction, we are looking at the introduction through a facility-based model so that in fact there is support for persons who may be using the test themselves and if they actually are reactive on a test result. So there isn't the intention at this point to just have self-test kits go out there and have people use them on their own. That actually would require, and that's one of the reasons why I shared the app the link app that I showed you, because in fact that would actually provide like a virtual platform where people could actually link back in with persons who would actually be able to provide them with guidance and the kind of supportive care that they would need in the case of having a reactive self-test. It's always important, and again, I stress that it's always important to bear in mind that a reactive self-test has to be confirmed within the health service, and therefore people who have a reactive test must understand that they do need to be in touch with the health service beyond that, because a reactive self-test does not necessarily mean that you are HIV positive. And even a negative self-test, depending on when you take it, because we talked about window period and all the rest of it, you know, it also may require you to do a further test. Having said that, I think, you know, most, for the countries that have actually been using HIV self-testing, they've actually, as you saw from the data from WHO, they have actually not experienced levels of self-harm and so on. One of the most important things is, in fact, to ensure that that data is tracked and that we know what is happening with persons who are actually using HIV self-testing, so that if there are those situations arising, they can be addressed. But the most important thing is to put in place a system upfront, like the virtual platform, like the triaging, so that in fact people actually do have support and that they're not just, you know, taking a self-test. We're introducing something new. We really have to do it in you know, a phased way, and really look at making sure that people have the kind of support that they need, and not you know, just send them out there without having that kind of support.
Thank you so much, Valerie. I see a raised hand, but before I acknowledge that individual, just reminding you guys that we have a few more minutes. So if you want to get a question in, now is the time to put it in either the chat box or the Q&A, or raise your hand. Acknowledging Rohit Sakar to ask a question.
Thank you very much for this opportunity. And thank you, Dr. Valerie, for this beautiful presentation. I have two questions. Number one, could you please share any data that the continuity of testing for a certain individual or in Q population? Like how many population have continued having self-testing for more than a year, like every 6-month interval? And my second question is that, have we identified, I mean, any data that correlate self-testing and increase or decrease vulnerability towards HIV? Hello?
Yes, I think I heard your second question clearly. I think you asked, has self-testing increased vulnerability to HIV?
Yes.
Okay, and the first question?
First question was that, do you have any data that shows continuity of self-testing for more than a year? Like if a person started self-testing for the first time, he or she continued to having the self-testing for, like, say, every 6-month interval.
Okay, so let me take the second question that you had asked initially, which relates to you know, persons who are actually on. In fact, even as we did the focus group, it was clear that there were persons, and these were KPs who actually we spoke with. It was clear that there were KPs who were actually doing testing through the regular channels, or in some cases, they were actually using some of the tests that are used in the regular channels on themselves. So they were actually doing that. So they were actually testing with some degree of regularity, some of them. So that they were testing every 6 months to a year, they would test themselves and to see what their status was and so on. So there are people who would actually use the self-tests, you know, with some level of regularity to ensure that, to monitor their own cells in terms of HIV. if in fact, and I can't say that I have any data to hand right now that could say to you, well, X number of people would continue to use the tests over a longer period of time. I don't think that I actually have that data at hand right now, but it's certainly something to look at, because it is clear that even as we look at the data about and talk with persons who self-test, whether they go and do not doing self-testing, but they go to a place and actually have their test done, that they may do so with some level of regularity. So I think that is certainly something that I would expect that persons who are doing self-testing would actually, in that sense, continue to test. Whether in fact it has increased vulnerability to HIV, I have not seen any data that indicates that that has actually been so. I think the idea of testing as a part of a basket of prevention services has been there for a long time, and it actually is something that we have promoted as part of the prevention service. But it is all supported by counseling and the prevention services and so on. And I would remind you that the slide that I had up that talked about where HIV self-testing fits in the scheme of things is that in fact it fits very much within that framework, and it doesn't sit outside of that framework. That's the support in terms of prevention services and so on. I think it also came up in the poll that I think people think this is a very important part of what is necessary. And so how we make sure that that is integrated into HIV self-testing, and it's not just, which is what was happening in some countries, pharmacies were just bringing in self-tests and people were buying self-tests. And if you want to avoid that, then you have to look at the other side. How do you introduce it in a way that ensures that you put in place the supporting structures that are necessary to make sure that people have the required prevention basket that surrounds testing, because testing is just part of all of that.
Okay, thank you so much, Valerie. We have two last questions. The first one, what generation is the test kit?
Mm-hmm.
You can answer that one now.
Uh-huh. So this, the OraQuick has actually been around for quite a while. I don't know if you're asking about all of them or if you're asking about OraQuick itself, but OraQuick has actually been a test that's been around for quite a while, and it actually is an antibody test. They have actually been looking at whether in fact we actually have any of those antigen antibody type tests, which would be like second, third generation tests. But the OraQuick has actually been an antibody test that has been around. Of course, the manufacturers would have improved it over time. In fact, I saw on the WHO pre-qualification that they actually had an initial and then a later date of pre-qualification when they made changes to the kit. So I can't say right now if it's first, second, or third generation, but it is actually a kit that has been in use for quite a long time, and it has been improved by the manufacturer over time.
Okay, and our final question for the session, in respect of the protocol, etc., what is the process envisaged for countries which have already initiated work towards self-testing?
So this is one of the reasons why it's really important for us to have those discussions with countries and to reach out to both ministries of health and the organizations that work with KPs and with the IPPF to identify, exactly where we're at and how this intervention can assist. If there are countries, and it would be interesting for those persons who are on to know, which countries may have already engaged in work around HIV self-testing. I know that, as I said, we have been in discussion with CVC, with PAHO, and with PANCAP on this. And so far, I haven't had any feedback in terms of countries that have actually been working on HIV self-testing introduction. So perhaps it might be useful if anybody's on who actually has been involved with that, it would be useful to know. But we would certainly find that out as part of the initial phase of the process.
All right, with that said, let me thank you, Valerie Wilson, Director at the Caribbean Med Labs Foundation. I want to thank you so much for a very informative and detailed presentation, which I am sure all our participants enjoyed and learned a lot from. Also to our participants, thank you so much for spending some time with us this morning, and we do hope that the presentation was useful and provided information that you will be able to utilize in your various tasks. This is a series of webinars, so we're asking you to look out for the next CVC webinar in which we hope to see you all. Thanks again for participating and have a good day.
Thank you very much. Thanks to CVC for inviting me, and thanks to you all for participating. Have a good day.
All right, thanks a lot.